Hello, so this is an introduction to burns as dealt with at Leicester Royal Infirmary. This is very much a presentation about minor burns, not about burns as part of major trauma. It's just to take you through a little bit of the things that you might need to do other than first aid. The first thing to note is that we do have a proforma for this. So when you get a child with a burn, you don't necessarily need to write the notes in the notes. You can write it down on this proforma. It will take you through everything you need to do, and using it will genuinely make your life easier. You can find it in the drawers behind you in minors. It will tell you when to refer and what to do, and it also gives you the tip-off for A forms. Remember, anybody with a burn under 2, they need an A form doing, even if the mechanism is perfectly legitimate. You will probably be doing a few of these because the bulk of our burns are in toddlers who poured hot water or cups of tea over themselves, and so they all need an A form. So the first thing is about pain relief and first aid. Not everybody coming in will have had either of those things, and burns are extremely painful, and it doesn't matter how big they are. So give drugs, be generous, give fentanyl, give paracetamol. We actually have a bath we can put people in. It doesn't need to be freezing cold. The play therapist will help you run it. So we quite often give screaming toddlers some intranasal fentanyl, put them in the bath for 10 to 20 minutes, and then maybe wrap the burn up in cling film, and then get the burns team to see them. What the cling film does is it covers the exposed nerve endings and stops all the pain from the air going over the exposed nerve endings, which was one of the major causes of pain in burns. Before you do that, it's worth taking some pictures. Again, describing bones over the phone, it can be very difficult. When you're referring to the plastics team, telling them you've got a photo that they can look on their phone, that's really useful for them to be able to see. So assessing burns, the first thing to remember is that erythema doesn't count. So where it's just red, that doesn't count in when you're calculating the surface area that's burnt. Any blisters indicate partial thickness, whether that's deep or superficial, but it's definitely at least partial thickness. Lack of pain over a burn is not good. That suggests a full thickness burn. If you're worried about working out the calculation, because people don't tend to burn themselves tidily, in nice smooth areas, actually getting an app like the Mersey Burns app, you can literally just draw on where they've burnt, and it will tell you what the management is for that burn. So what percentage it is, if it needs fluids, and if you put their weight in, it will do the fluid calculations for you too. That's a really useful thing to think about doing. When you're thinking about whether it's a superficial or a partial thickness burn, that's really important because it tells you a little bit about how it's going to heal. Superficial thickness burns will almost certainly heal without a huge amount of help, but deep partial thickness burns may need grafting. Essentially, if you've got a blister that's popped and you can touch the skin underneath it, if it's nice and pink and blanches and comes back quickly, then that's a superficial burn. If it blanches and comes back really slowly or doesn't come back at all, then that could be a deep partial burn and may require further input, and that's more significant. The proforma takes you through when you need to refer, but obviously any full thickness burns will need to be referred. Anything over 5% will need to be referred. If there's any child protection issues, which unfortunately sometimes there are, that will need to be referred. And any special areas. So special areas are places which, if scarring, are going to cause you particular problems. So that might be over joints. So for example, hands and feet, if you burn those, you burn your fingers, they stick together, that's a real problem. If you burn your face and it scars, that's a real problem. Same on the genitals, and that the proforma takes you through all of that. The plastics team will definitely ask you about the history, so they want a really careful history from you. Remember, these people tend to be surgeons. They don't tend to have extensive child protection experience, so they'll be expecting you to be the experts about that. Now, if you don't feel that you are an expert, then please do ask somebody else. But what you want is a really careful story of exactly how the heat come into the contact with the child, exactly how long it's been left for. So, give an example, if there's milk in the tea, that actually is likely to decrease the depth of the burn quite significantly because it cools the tea down quite rapidly by a few degrees. If the tea is 5 minutes old, it will be significantly colder than if it's fresh. There are other types of child protection issues other than inflicted injury, so you might want to think about kind of supervision issues. Have you got 5 children in the kitchen? Is the eldest of them cooking? Where are they storing stuff? That kind of thing. They'll definitely ask you about the size of the burn. I mean, that's really significant and a useful thing to know, and they'll ask you about the depth. They will come and reassess all of these things themselves, but it will give them a little bit of an idea of what types of action they might need to take, whether they're going to need to refer this on, and whether they're going to need to discuss this with their senior. You're going to need to make some kind of plan for review and a plan for potential being transferred out. So if the patient needs to be transferred, which it would usually be to Queen's unless they're severely burnt, in which case they might go to Birmingham, you want to think about exploring all options, and so speak to the plastics team early about that. It's unlikely if you've got a simple burn that can be dressed, that's a superficial thickness. If you've got a large burn, or it's a particularly unusual area, or there's something other significant about it, then it is a possibility. Currently in the COVID situation, all wound reviews are actually being done by the burns team, and so in the minors area you'll find an area to refer wound reviews for the burns team, and they will pick them up. They've got a burns and plastic clinic that runs 3 times a week, and they literally bring the patients in, take down their dressing, check that the wound is healing okay, appropriately redress it with whatever ointments or clever things they feel like applying, and then send them home and bring them back until they're happy with the healing of the wound. They do a really great job. It's a really useful service, and I certainly would encourage you to refer appropriately and respectfully to them. In terms of other burns, if you really feel that it doesn't need any management at all, then just check with somebody that it doesn't need a redressing or anything like that. It does depend a little bit on the skill of the parent, and it can be difficult to get a lot of the dressings that we would use normally in pharmacies. I hope that answered most of your basic questions, but like I said, this isn't a detailed exploration of burns, and I'm certainly not going to go into how you dress them, because as medical staff this is not something that we do very much. But if you do have any further questions, then please just catch people on the floor. See you soon. Bye bye.